All right, let's jump right in. Today, we are talking about one of the biggest shakeups in healthcare data security that we've seen in, well, over a decade. I'm talking about the major HIPAA updates that are coming in 2026. Look, if your organization has anything to do with patient data, this is something you absolutely have to get your head around. So let's do this.
So let's start with a number, 133 million. What is that? That's the number of people, individuals, who were affected by healthcare data breaches in just one recent year. No, that is not a typo. It's an absolutely mind-boggling number, and it really shows you just how vulnerable our most personal information has become. This right here is the reason we're even having this conversation.
In this quote, it really hits the nail on the head, because the stakes for getting this wrong have literally never been higher. We're talking about regulators stepping up enforcement in a big way with fines that can easily top $1 million for a single screw-up. But you know what? It's not even just about the money. It's about trust. Once you lose that, it's so much harder to get back. So why now? Why this huge push to modernize everything? Well, it's pretty simple, really. The rulebook we've all been playing by for years just isn't cut out for today's world. The threats have gotten smarter, the technology has changed, and the old way of doing things just leaves too many doors wide open. The regulations are finally catching up. When you look at it this way, it all makes sense. You've got these incredibly sophisticated cybercriminals who see healthcare as a prime target. Then you have the main security rulebook, which was written back in 2003. I mean, think about the phone you had in 2003. The tech world is completely different. Then you throw in federal regulators who are not messing around anymore. It's the perfect storm, and it created a situation where a massive overhaul wasn't just a good idea, it was absolutely necessary.
Okay, before we dive into all the new stuff, let's just take a quick second to make sure we're all on the same page. Think of this as laying the groundwork so that all the big changes we're about to talk about make perfect sense. Everything, and I mean everything, revolves around this one thing, PHI, or Protected Health Information. And listen, this isn't just about your diagnosis or your medical chart, it's literally any piece of information that can be used to identify you and is connected to your healthcare. We're talking lab results, billing records, even the dates of your appointments. If it points to you and it's related to health, it's PHI.
So who's responsible for protecting all this data? Well, it breaks down into two main groups. First, you've got your covered entities. These are your frontline organizations. Think hospitals, doctors' offices, insurance companies. Then you've got their business associates. These are all the partners and vendors they hire that might handle PHI, like IT companies, billing services, consultants, you name it. Under HIPAA, both of them are on the hook. There's no passing the buck.
All right, let's get into the good stuff. The first big area of change we need to talk about is the privacy rule. This is all about patient rights and putting new limits on how their most sensitive information can be shared.
So here's the bottom line. Patients are getting more control, a lot more. The new rules are putting much tighter locks on information related to things like reproductive health care or treatment for substance use disorders. And here's how they're enforcing it. If an organization wants that specific kind of data, they now have to provide a signed attestation. It's basically a legally binding promise in writing that they are not requesting it for a prohibited reason, like using it in a criminal investigation.
And this brings us to a date you need to circle on your calendar, February 16th, 2026. That is the hard deadline for every single covered entity to update their Notice of Privacy Practices. You know that document you get that explains how your data is used? Well, it has to be updated to spell out all these new, stronger protections for patients. This is not a drill. It's a mandatory compliance date.
Okay, now we're going to pivot to what is, frankly, the biggest part of this whole update, the security rule. And this isn't just about changing a few lines of text. This is a complete shift in thinking. We are moving away from a world of just ticking boxes on a compliance checklist and into a new era of continuous, always-on security.
And if you want to understand this whole shift, it really boils down to this one change right here. For years, a lot of security measures in HIPAA were addressable. That gave organizations some wiggle room. You could argue that a certain control wasn't reasonable for you and choose an alternative. Well, that flexibility, it's gone. Many of those key safeguards are now simply required, period, non-negotiable.
Let's start with a big one, multi-factor authentication, or MFA. You know when you need a code from your phone to log in? That is no longer just a good idea or something you only do for remote work. The new rule makes MFA mandatory for all access to systems with electronic PHI. It doesn't matter if you're in the office, at home, or on the go. If you're touching PHI, you need MFA.
Next up, encryption. This used to be one of those addressable items, not anymore.
Now it is required. All electronic PHI has to be encrypted, both when it's just sitting on a server or a laptop, what we call at rest, and when it's being sent over the internet in an email or a file transfer, what we call in transit. It has to be locked down at all times. No excuses.
And believe me, it doesn't stop there. Organizations now have to perform full-blown risk assessments and compliance audits every single year and document everything. You also have to be constantly testing your own defenses, with vulnerability scans every 6 months and full penetration tests at least once a year. Your vendors? They're under a much tighter leash. Business associates now have to report security incidents within 24 hours. And finally, you have to actually know what you're protecting. A complete inventory of every system and piece of software that can access patient data is now mandatory.
Phew, okay. That was a lot. We've gone through the what and the why. So now, let's talk about the most important part. What do you actually need to do to get ready? Consider this your game plan.
So let's break it down. Step 1, do a brand new risk assessment, but this time, measure yourself against these new 2026 rules. Find your gaps. Step 2, get to work on implementing mandatory MFA and encryption everywhere. That's a huge project, so start now. Step 3, get that new Notice of Privacy Practices written, approved, and ready to go way before that February deadline. Step 4, pull out every single one of your vendor contracts and make sure they can meet these new, tougher requirements. And Step 5, maybe the most important, update your staff training. Your people are your first line of defense. They have to know what the new rules of the road are.
So, I'll leave you with this final thought. This 2026 HIPAA update, it's about so much more than just avoiding some fines. It's about a fundamental shift in how we think about security. So the real question is your organization truly ready to move past that old-school compliance checklist and build a real culture where protecting patient data is a continuous, proactive mission? That's the challenge and the opportunity that lies ahead.